Assalamualaikum warahmatullahi wabarakatuh. Hi everyone. How are you guys feeling today? Well, I hope everyone is feeling fine today because our group, aka Group 3, are going to talk about something that is super important but often overlooked by our society, and it is anemia. So that's why our presentation today is entitled Anemia, a Neglected Health Concern and Why Iron Supplements Matter. So before we get into the presentation and the main topics, let me introduce myself. My name is Arfian Azahra Junefa Adi Purnama, and my student ID number is 2410911220068. And of course, today I'm not alone because I'm with my other six friends. They are Naila Fatina Rishana, Aisyah Hawa Nazifa, Selma Alfisha Faza, Nadira Ayu Handayani, Amalia Shifa Sekar Arum Putri, and Firda Nur Rahmatin. So now let's get into the presentation. But before we entered our main topics, why don't we talk about what is so important about today's topic? Why do we chose to talk about this topic? So anemia isn't just a simple or small health issue. It is something that can actually affect our entire generation future. Let me give you this data. So based on the most recent data from our Ministry of Health, 26.8% of kids age 5 until 14 years and 32% of people age 15 until 24 years old have anemia. And that was not a small number, so it's quite shocking because we could say that 3 out of 10 of our friends might actually dealing with anemia. So it's pretty scary because the scary thing is if we don't address anemia earlier, it can actually lead into a bigger problems. So first of all, it had a lot of bad effects on our daily life, which will be explained further by my friends after this. And it also will give you a long-term health risk. Let me give you an example. So a teenage girls who had anemia, of course, will grow up to be a mom, right, in the future. So once this girl had anemia in her teenage days, and when she had a baby in the future, it might also affect her baby in the future. Probably her baby might born with a low weight or even stunting. Well, speaking about stunting, did you know that Indonesia has a national goal to reduce stunting to 14% by 2024? And to achieve this, the government actually planned a goal to reduce anemia rates in our country because anemia might also lead to the kids stunting. So once a mom had anemia, it might lead her kids to a stunting, and this effect will be explained further again by my friends after this. So one of the reason why anemia is becoming so common in our society is that not enough people take iron supplements, even though the fact that the government actually provides free iron supplements for us teenage girls. Well, I remember when I was still in the senior high school, usually we got like an iron supplements every single month. But here's the sad fact, and here's the thing. Out of 12.1 million teenage girls in Indonesia, 8.3 million of them still don't take the iron supplements regularly. So sorry. Well, so that's a quick overview of why anemia is such an urgent issue and why we want to talk about it more. So I hope by this presentation, anyone who watched this presentation would understand and know more about the anemia. So the next part of this presentation will be explaining the definition of anemia by my friend Firda. Thank you.
Let me continue. So my name is Firda Nuramatin and my name is 2410911320029. So I want to bring a definition of what is anemia in this material. So, what is anemia? Anemia is a medical condition characterized by a decrease in the number or quality of red blood cells or RBCs, or a reduction in hemoglobin, which is the protein in red blood cells responsible for carrying oxygen throughout the body. This condition results in insufficient oxygen supply to the tissues and organs, leading to various symptoms.
So the next is symptoms of anemia. But before that, let me introduce myself. My name is Amalia Shiva Sekar Arum Putri A. You can call me Shiva. And my student number is 2410911320020. So here is a list of the most common symptoms and features of anemia. First one is weakness and fatigue. Fatigue is the most common symptom of blood loss. However, the fatigue that characterizes anemia is slightly different from normal fatigue. Fatigue or tiredness occurs because your body lacks hemoglobin. Hemoglobin is a special protein that binds oxygen and transports it throughout the body with the help of red blood cells. When your body lacks hemoglobin, all your cells and tissues will automatically be deprived of oxygen. As a result, the heart has to work harder to circulate oxygenated red blood cells throughout the body. That's why you feel tired quickly. The second one is pale skin. Pale skin is one of the common signs of anemia. Hemoglobin is what gives blood its red color. The skin tissue itself has many small blood vessels. The hue of our skin is to some extent influenced by proper blood circulation. That's why, when hemoglobin levels are low, the skin can be pale. Pale skin color as a symptom of blood loss can be seen on all parts of the body or certain parts only. However, the areas that usually appear paler are the face, gums, inside of the lips, lower eyelids, and the back of the nails. Someone whose skin is pale is usually already experiencing symptoms of moderate to severe anemia. The next one is dizziness and headache. Dizziness or a spinning sensation that appears suddenly can be a symptom of anemia. The cause is the same, namely because the body lacks an adequate supply of hemoglobin. Apart from being responsible for giving blood its red color, hemoglobin is responsible for carrying oxygen and nutrients throughout the body. When hemoglobin level is low, oxygen supplies may not be able to reach the brain. That's why you feel dizzy, especially when standing up from sitting or laying down. In addition, lack of oxygen also makes the blood vessels in the brain swollen and persist on other parts, causing headache. The next symptom is shortness of breath. Lack of hemoglobin levels in the blood result in a lack of oxygen supply throughout the body. This condition makes the muscles not get enough oxygen to be able to do normal daily activities such as walking, going up and down stairs, and even during light exercise. When oxygen levels are insufficient, the breathing rate increases. This is one of the ways the body can get enough oxygen. However, the more the lungs work hard to accommodate oxygen, the chest will feel tight even with light activities. Okay, the next one is heart palpitations. The characteristics of anemia due to iron deficiency generally cause a sensation of a racing heart, which is called palpitation. The lack of hemoglobin levels in the blood makes the heart have to work extra hard to deliver oxygenated blood. That's why the heart beats faster and faster as it tries to pump oxygen. The symptom usually occurs when you have been suffering from anemia for a long time. The next symptom is dry skin and hair. Symptoms of anemia can also be seen from the condition of the skin and hair. Dry skin and damaged hair are usually one of the signs that someone is iron deficient. This is because the supply of oxygen and nutrients to various organs and body tissues is reduced. Lack of oxygen makes tissues weaker, including the skin and hair. In fact, some people who have anemia also experience symptoms of hair loss. Okay, the next one is swollen tongue and sore mouth. Another characteristic that indicates that you have anemia is a swollen, inflamed, and pale colored tongue. This condition is again caused by low hemoglobin levels, making the tongue no longer pink as it should be. Meanwhile, low levels of myoglobin also cause pain in the tongue and cause it to swell. Myoglobin is a protein in red blood cells that help support muscle work. Anemia symptoms also cause other oral problems such as dry mouth, red crack at the corner of the lips, and mouth ulcers. And the last one is cold hands and feet. Symptoms of lack of blood due to iron deficiency anemia can make your hands and feet feel cold. This is due to the lack of oxygen supply flowing from the heart to these two parts. Some people even feel cold more easily on certain days than others because of this disease.
Hello, my name is Nadira Ayuhandayani with study number 2410911220030. Now I want to tell you about the impacts of anemia. 1. Decreased immune system strength. Anemia reduces the number of healthy red blood cells needed to carry oxygen to tissues. This weakens the immune system, making the body more vulnerable to infections. 2. Increased risk of pregnancy complications. In pregnant women, anemia increases the risk of complications such as preterm birth, low birth weight, or postpartum hemorrhage. Severe anemia can even pose a life-threatening risk to both the mother and the baby. 3. Increased risk of infections. A weakened immune system caused by anemia makes it harder for the body to fight bacteria, viruses, or other microorganisms, increasing the risk of infections. 4. Decreased productivity. People with anemia often feel tired and weak, reducing their ability to work or perform daily activities efficiently, both at work and at home. 5. Decline academic performance. Anemia, especially in children and adolescents, can impair brain function. Concentration, memory, and learning abilities decline because the brain doesn't receive enough oxygen to function effectively. 6. Reduce physical fitness. A lack of oxygen in the blood makes it difficult for muscle and organs to function optimally. This results in fatigue, shortness of breath, and decreased physical performance even during daily activities.
Assalamualaikum warahmatullahi wabarakatuh. My name is Naila Fatina Rishana and my student number is 2410911120006. And now I will explain you about the prevention of anemia. Okay, increasing balanced nutritional intake, including eating foods rich in iron. Iron from animal foods is absorbed by the body better than from plant foods. Animal food, under normal condition, the absorption is 25%. In anemic conditions, the absorption is more than 35%. And plant foods, the absorption is just 1 till 5%. So, To ensure optimal iron intake, it's important to include a variety of animal and plant food. Combining this can help improve overall the absorption and support a better nutritional intake. Okay, next. Food fortification. Food fortification is add one or more nutrition to food to increase the nutritional value of the food, generally carried out in the food industry. The examples are wet flour, instant noodles, and rice. This must be consumed in sufficient quantities as needed. Okay, thank you. The next material will explained by my friends.
Okay, so let's move to the causes of anemia. Anemia has a wide range of causes. There can many possible causes of anemia. It can occur when your red blood cell produce less in number, your red blood cells are destructing rapidly, and less is there is a loss of too many red blood cells. Okay, for the first case, red blood cells are producing less in number. You may suffer from anemia when your body fails to produce enough red blood cells. Some of these conditions where the body fails to produce enough red blood cells are, for the first is iron deficient poor diet. Iron is an essential component in the formation of red blood cell. So if your diet is deficient in, in iron, it leads to more risk of less production of red blood cell. And the second is poor absorption of nutrients. Some diseases, diets, and medicines inhibit the absorption of essential nutrition in the body, thus impairing the production of red blood cell. And the third is cancer and their treatment. Blood cancer, like leukemia and lymphoma, affect the production of red blood cells. Also, their treatments with chemotherapy and radiotherapy impacts the bone marrow and red blood cell formation. And the fourth is pregnancy. The volume of blood increase during pregnancy. Your body needs more blood to share with your baby, which means you need more iron and essential nutrients. But if your body lacks getting this nutrition efficiently, change are you develop anemia. Okay, and the second is red blood cell are destructing too rapidly. Okay, red blood cell have 120 days of lifespan in the body, after which they die. But if your body destroys this red blood cell in a short span, in such large number that even the bone marrow cannot make new healthy red blood cell, then you will suffer from anemia. Okay, some condition increase the destruction of red blood cell, like, okay, uh, for the first infection condition like malaria, and the second is disease like sickle cell anemia and thalassemia increase the destruction of red blood cell. And the third is immune hemolytic anemia, like immune system produce antibodies against RBCs or medicine, causing RBCs reduction. Okay, and the last is red blood cell count is decreasing. When your body is losing blood, you may lose large red blood cells, resulting in anemia. Okay, the blood loss can be due to, for the first is any surgery and the trauma from a road traffic accident, and the last is heavy menstrual bleeding. So that's all from me. Thank you.
Okay, first let me introduce myself. My name is Salma Alfisha Faza. You can call me Salma. The student number is 241091122 and 000 and 8. Okay, let's get to know with iron tablets or red blood tablets, or in Indonesia, we call it tablet tambah darah. Tablet tambah darah or iron tablets are a simple and an effective way to prevent anemia, particularly for high-risk groups. Combined with a nutrient-rich diet, regular supplementation of blood tablet can significantly improve overall health and well-being. And now let's get to know who's people or categories that needs to take their iron tablets. Here I present four categories of them. The first one is pregnant woman. The second one is individuals with poor diets or people that their intakes regularly for foods are less in nutrition. And the third one is anemia patients, of course. And the last one is adolescents, especially girl at age 12 until 18 years old. So I want to focus at adolescents more. Adolescents, girls, especially girls, are having menstruation regularly every month. When menstruation occur, adolescent girls lose iron during menstruation, which increases their need for dietary iron. That's why we need to take iron tablets every month. And now I will explain how to take the iron tablets. The first one is we need to take it once a week or every day when menstruation occur. So once a week is when we don't the menstruations isn't occur. And the rest of it, 1 week in every month, we consume it every day. And the second one, when we after we consume the iron tablets, avoid consuming with tea, coffee, or milk because it will decrease the reabsorption or absorption of iron in our body. And the last one is take the tablet on empty stomach with vitamin C food. We can take the vitamin C from the supplements also and from the food that we take, especially like juice, orange juice, and other food that has vitamin C on it. It will increase the absorption of body with iron. Iron tablets for Indonesian girls. In Indonesia, the iron tablet supplementation or tablet tambah darah program for adolescent girls began in 2014 and has now become one of the specific intervention aimed at reducing stunting. The program's targets are adolescent girls aged 12 until 18 years who are enrolled in junior high school and senior high school, or their equivalents. The recommended dosage is 1 tablet per week for 52 weeks in a year. Stay active, focused, and healthy. Start with your iron supplement today. Thank you. That's all from our teams. Thank you so much and stay healthy.